Welcome, doctors. Let's talk about something that's at the heart of your practice's financial health: medical coding. It's the backbone of getting paid for the care you provide, translating patient diagnoses and procedures into standardized codes that insurance companies understand. But here's the thing: errors in coding can turn that streamlined process into a headache. Claim denials, delayed payments, compliance risks. Sound familiar? These challenges don't just hurt your bottom line, they affect your ability to focus on what really matters: delivering quality care. So, in today's video, we're diving into how you can reduce medical coding errors and ensure accurate, timely reimbursements. Let's start with why this is so important. Accurate medical coding isn't just about crossing your T's and dotting your I's. It ensures claims are approved without unnecessary back and forth. It keeps you compliant with regulations like 𝗖𝗶𝗴𝗏. And most importantly, it protects your financial stability. But despite its importance, errors still happen, often because coding is complex. It's an evolving system with payer-specific quirks that can trip up even experienced coders. So, what's causing these errors? For starters, lack of proper training. Coders who aren't familiar with ICD-10, CPT, or 𝗔𝗃_cs codes may struggle to apply them correctly. Then there's ambiguous physician documentation. If your notes aren't clear, coders are left to guess, and that's a recipe for mistakes. And let's not forget how often coding guidelines change. Staying current on these updates, like the shift from ICD-9 to ICD-10, is a job in itself. Finally, every insurance company has its own unique requirements, which can complicate things even further. But here's the good news: these errors aren't inevitable. There are practical strategies you can adopt to reduce them, and we're going to walk through those together. First, ongoing training and education for your coding staff is a must. Think of it like continuing medical education for coders. Workshops, webinars, updated materials. These resources help your team stay sharp and on top of industry changes. When coders are confident and well-trained, the margin for error shrinks dramatically. Next, let's talk tech. Investing in advanced coding software can save you time and money. Today's tools can flag errors, suggest accurate codes, and even update automatically to reflect the latest guidelines. They don't replace human coders but act as a safety net to catch mistakes before they turn into claim denials. Of course, even the best software can't fix poor documentation. That's why clear, comprehensive notes are so important. Include details like symptoms, diagnoses, procedures, and treatments, anything coders might need to assign the correct codes. Remember, coders aren't mind readers. The clearer your notes, the easier their job becomes. Another game changer is implementing a quality control system. Think of it as a final checkpoint before claims go out the door. Having a team of experienced auditors review coded claims can catch errors early, preventing costly delays and denials. But what if your team is stretched thin? That's where outsourcing to professional medical coders comes in. Companies like Staffingly specialize in accurate medical coding, keeping up with the latest systems and regulations so you don't have to. By outsourcing, you can offload the complexity and let your in-house staff focus on patient care. It's an efficient, cost-effective way to improve accuracy and reduce administrative burden. And let's not overlook the value of collaboration between coders and providers. When coders have questions about unclear documentation, they should feel comfortable reaching out. Likewise, providers should aim to provide thorough, precise notes. Open communication can bridge gaps and prevent mistakes from happening in the first place. So, what's the takeaway? Reducing medical coding errors isn't just about avoiding claim denials, it's about creating a smoother, more efficient revenue cycle. When you focus on training, leverage advanced tools, and ensure clear documentation, you're not just improving accuracy, you're setting your practice up for long-term financial stability. If your practice is feeling the strain of medical coding challenges, consider reaching out to experts who can help. At Staffingly, we specialize in providing highly trained medical coders who can seamlessly integrate with your practice, ensuring accurate claims submission and faster reimbursements. Thank you for joining us today, doctors. By addressing these common pitfalls in medical coding, you're not just improving your bottom line, you're freeing up time and resources to focus on what matters most, your patients. See you in the next video.
If you are looking for outsourcing services, schedule a demo today by visiting www.staffingly.com or emailing us at support@staffingly.com or call us on the number 1-800-489-5877.